So today I'm going to be showing a video on a head-to-toe assessment. And to begin my head-to-toe assessment, I'm going to be checking the chart for my patient's vitals, previous injuries, surgeries, anything that might be different than the typical findings. I'm also going to be assessing the names, the birth date, which will be my two identifiers. I want to see if this person has any problem with mobility or anything else that might alter the test results that I have. I'm going to be checking the chart for any allergies such as latex because I'll be using gloves during this procedure. And yeah. Okay, so that's my check of the chart, just an overall check of the chart. Okay, so now I'm going to gather my supplies. I'm going to gather everything I need for vitals, my stethoscope, of course I have my name badge, my pen light, an otoscope. I'll be using my pen light for my otoscope, but I would gather that as well. Pens, I'd be gathering a sharp and dull object, scissors, and tape in case I find any wounds. Pens for documentation, if there's not a computer or if I need to jot something down. So just all the supplies that I need. So I would, knock on the door. Hi, my name is Desi. Can I first get your first and last name?
David Dawn.
And your birthday?
9391.
So those are my two identifiers. So then I begin by making sure that I have the right person, that I'm in the right place. Today I'm going to be performing a head-to-toe assessment. It just means I'm going to be looking you over from head to toe, performing a few tests on you. Is that okay if I do that right now?
Yeah.
So after I've explained that, I'm also looking for facial expressions, mood. I'm looking for if he has symmetry, if the color in his face is correct, looking at his hair, just doing an overall view of him. I'm looking at clean, if there's any body odors. Since I'm standing next to him, I would have recognized any body odors. I'm looking for wound vacs, oxygens, tubing, anything connected to my patient to assess that not only are they correct and in the chart, that they are also, whether they're going to impede my physical assessment or not. Also during this time, I'm assessing the room. And before I even stated what I was going to do, I would look around the room to see if any family was there. And I would ask would you like your family in the room? Would you like them to leave during this test? You may be exposed so that I can check. Just give a little bit more information so that they can make the right decision that's for them. So now that I've checked the room, I've checked for safety, I've provided a little bit of privacy, I'm going to go ahead and perform the other parts of ADET. I'm also going to perform hand hygiene, making sure that I have everything in the room that I needed before I began. And now that I have, I'm going to go ahead and start. So I'm going to put on some gloves. This is a clean procedure, so you just need clean gloves. My patient doesn't have any precautions, so that's why I'm not wearing any protective gear, any PPE. I'm also looking in the room for things like glasses, tools that they need to walk, such as a wheelchair or a walker. Thank you. Anything that is connected that they might need to use, just so I can be aware of those things and provide the best care as possible. So the room is safe so that I can move around. We have no family in the room, so I'm okay to go ahead and do my physical assessment. Privacy has been provided, and let's begin. Okay, so now I'm going to begin by just touching around, feeling around your face, around your head and neck and shoulder area, okay? So I'm looking for hair distribution. I'm looking for eyes and eyelashes on the hair. I'm looking to make sure there's no lumps or bruises or anything, lacerations, wounds. I'm checking to see if there's any inflammation or redness. Also checking temperature. I would have gotten that with my vitals. At this point, starting with everything in the vitals, I would have got a temperature, pulse, BP, and before doing my pulse, I'm going to check the cap refills on both hands. And while I did that, stuck the pulse oximeter on the finger, I'm going to check the feet for cap refill. Just while I'm doing that. So I'll go ahead and do that. And the other, and it is within an acceptable range for this patient. So I'm looking at the head and neck hair distribution, the nose, the septum is aligned. I'll also check that when I start looking more in depth. Right now I'm just doing an overall assessment of pain, temperature, any pain when I touch.
Nope.
And I'll be asking that throughout. I'm looking at temperature, checking with the back of my hand. I'm looking at moisture, any masses, anything like that, any lesions. When I'm back here checking the back of the head, I'm also going to ask him to lean forward. This will give me the opportunity to check spine alignment, also give me a check of a barrel chest, anything abnormal or out of line for the patient chart that I just checked. I can ask about any surgeries at this point. Have you had any surgeries?
Nope.
Have you had any, what's the word I want to use? While I'm checking for an alignment, I'm asking about surgeries and other procedures or accidents that may have happened that may have altered this. I'm also looking for any pain as he bends down to see if there's any of that. There is none. So, okay, go ahead and sit back up for me. I'm assessing respirations while I'm doing either during the first part of it, during the vitals. I can check now while I'm doing just a visual scan. I can also do it while I'm checking the lungs. There will be none of that during my assessment. So my patient smiles, so then I can see that the face is aligned, that everything is symmetrical, the eyes are symmetrical, the ears are symmetrical.
No, I got
During the communication, I can see the tongue, he's talking to me, I can see that he has no speech impediments, no speech issues. I'm also checking the dental, his dental hygiene at this point, making sure that there is no sounds. He's obviously been through this a couple times through this video. But yes. No, at this point I'm just looking at the face and the color. I'm looking at the color of the conjunctiva to see if there's any inflammation, any swelling. There isn't. I'm looking at the color of the iris and the white of his eyes, making sure they are white, that there is no redness. I'm looking at the pupils. You're going to get me in trouble. I'm looking at his pupil to make sure that they are of the appropriate size. They look approximately 4 millimeters, which is within range. Okay, at this point, I am going to shine a light in your eyes, okay? So, while I'm doing this, I'm looking for pupil reaction while the light is in his eyes, but I'm also looking for the other eye, looking at the other eye to make sure that both reactions are appropriate and equal. And they are. I'm just going to check with an otoscope. Here's my otoscope. In the ear. I'm pressing along the mandibular for any pressure, any pain. I'm looking for any inflammation or redness. I'm also going to check the other ear and do the same with a little bit of pressure points. I'm going to check in the nose, looking at the septum, the nose, seeing if there's any blockage. Can you open your mouth for me? I'm looking at his mouth. His tongue is sticking out, which is a cranial nerve test as well. I'm looking at teeth, oral mucosa, making sure it's nice, moist, and pink. Can you go ahead and swallow with your mouth open? Open your mouth and swallow. I'm checking to make sure the facial expressions are appropriate. That the lips are pink, nice. I was looking at the uvula, all of the things I need to. Go ahead and bite down for me. Okay, he can bite down, so that is another cranial nerve test, making sure that everything is in alignment. At this point, I'm going to go ahead and pinch the skin above the cuvula here. I'm going to give him a warning that I'm doing that. I'm going to pinch his skin. This is just checking for Tigger. Wouldn't hit my patient. I wouldn't hit my patient. I was just checking to make sure I'm palpating to make sure that the body has no masses, no lesions, no wounds. Alrighty. Now I'm going to go ahead and palpate the neck. I'm looking for a jugular vein distension. I'm checking the lymph nodes, the thyroid. I'm looking for alignment of the throat, making sure there's no masses, no pain when I'm touching. Can I do that? Can you go ahead and swallow for me? Okay, so I'm seeing that the patient is able to swallow. Okay, go ahead and turn your head against my hand and the other way. And your shoulders, can you lift them? Alrighty, so that is all correct and appropriate. Okay, so at this point, I'm going to go ahead and check the nose, the nares. Go ahead and include. Can you go ahead and press one nose down, one nostril, one nostril down? I don't know why I'm so nervous. One nostril. Can you breathe? And do the other. Okay. Can you go ahead and smell this for me? What does that smell like?
Cinnamon.
Okay, it smells like cinnamon. So that is correct. Okay. I'm also going to perform a whisper test, in which I'm going to whisper a number, and then I want you to tell me what the number is, okay? Can you tell me what the number is?
7.
Okay. And on this side?
6.
Okay. So then I performed a listening test. My close to me. Okay. So now that I've performed that, I'm going to go ahead and take a listen. So what I'm listening for, I'm listening to the apical, the apical, pulmonary, Erb's point, tricuspid,
Sorry, I'm not
and
sure how to
mitral.
help with that.
That was my Google Home, sorry. And mitral areas. I'm also going to be performing listening for the lungs. I'm going to listen in a zigzag pattern all the way down. Shh, could you please not say anything for me? So while I'm over the apical pulse, I'm also going to be assessing the apical pulse or apical point for approximately 1 minute. While I'm here, I'm also going to palpate the point of maximal impulse, which is between mid-clavicular and the 5th intercostal space, just to ensure that I am doing a good assessment there. Okay, now I'm going to have them lean forward for me. And of course, I'm doing the zigzag pattern all the way down. Can you, while I'm doing this, I'm also going to ask for a couple of deep breaths. I'm going to ask for them to assess that the right side is the same as the left side, that the upper is the same as the lower lobes. Can you take a deep breath for me? And again. This also gives me a chance to assess his level of consciousness. The fact that he can follow orders, that he knows what his name and his birth date is. But I'm going to ask him a few other questions. I would usually do this through conversation, but for the sake of this video, do you know why you're here?
I live here.
Okay, do you know where you are?
Home.
Okay, do you know how long you've been here?
Over a year.
And what did you have for breakfast?
Breakfast bowl.
Okay, so I've established that he understands some memory. He has it in memory. He knows where he is. He's alert and oriented, which is exactly what I've seen in his chart. So I'm going to assess that it's correct in his chart. If I've seen any abnormalities that weren't in the chart, of course, I would jot those down in memory for later. If I've seen any wounds or anything like that, I would go ahead and make note of those. I would measure those wounds, those sorts of things. Okay, so now I'm going to continue down the line. So I've already pressed for cap refill in both the hands and feet. I've done a pulse ox after I've done that in the hands, just to ensure that they were that the reading would be accurate. So now I'm going to go ahead and listen to the stomach before I begin to palpate. I'm going to listen to all 4 quadrants. I'm listening for gurgling sounds. I'm listening for all kinds for the bowel sounds in all 4 quadrants. I'm going to listen to a group in the aorta, and I'm listening for a group in the neck. During the neck turn, I was assessing for jugular vein distension. I was checking to ensure that there was no jugular vein distension. I was listening for the group in the throat. Okay, so now I'm going to go ahead and ask my patient, if possible, can you stand up for me? Okay, I'm going to be performing a range of motion test. So, I'm going to make sure, can you stand on one foot? And then the other. Close your eyes. So, I'm assessing upper body appropriation, making sure that the body is aware of where it is in space. And then I'm going to be checking range of motion. Muscle mass, I'm looking at color, skin. I'm also checking for any type of injuries, any wounds that weren't in the chart, that were in the chart. I'm making sure I'm getting measurements if that's the case. I'm checking for range of motion. In the neck, can you roll your neck for me? All around. Okay, thank you. You take 2 steps forward for me. And 2 steps back. Alright, I'm checking for the legs. I'm looking at the legs to make sure that they have range of motion as well. Looking at gait. Ensuring that the proper gait is there. Okay. Go ahead and sit back down for me. Before he would have stood up, of course, when I went into the room, I was assessing for any tubing or anything like that, but I was also assessing to see if there was any wheelchairs or walkers, anything that he would have needed to have completed that. Okay. And I'm also going to perform a pain test. So I'm going to look at the hands and feet to see if they know some, with the eyes closed, pain versus dull. In the feet, pain versus dull. Body mass, skin color, temperature, moisture. That's all appropriate. Inflammation. Let's see. Making sure that the pedal pulses, checking reflexes in the knees, and all the reflexes that I need. I'm gonna push your foot forward for me, against my hand, push it away, against my hand, pedal pulses. My goodness. Alright. Sorry about that. And then, check mood. It's a lot harder to do step by step. Trying to see if I forgot anything. So after that, I would take off my gloves, take my supplies, make sure that I perform hand hygiene, opened up for privacy. I would also make sure that I documented any of the findings, any of the findings that I've had, all the vitals that I have taken, make sure that they are accurate and correct. Alright, and that's the end of my assessment. Thank you.